A game changer. FDA authorizes Abbott Labs portable 5-minute coornavirus test the size of a toaster. Chicago. A 5-minute point-of-care coornavirus test could be coming to urgent care clinics next week, and experts say it could be game-changing. The U.S. Food and Drug Administration issued emergency use authorization to Illinois-based medical device maker Abbott Labs on Friday for a coornavirus test that delivers positive results in as little as 5 minutes and negative results in 13 minutes, the company said. The company expects the tests to be available next week and expects to ramp up manufacturing to deliver 50,000 tests per day. I am pleased that the FDA authorized Abbott's point-of-care test yesterday. Get daily coornavirus updates in your inbox. Sign up for our newsletter now. Scott Gottlieb, former FDA commissioner, echoed Hahn's comments on Twitter, calling the development a game changer. Gottlieb also said it's very likely that we'll see additional approvals of point-of-care diagnostics behind this one, extending testing to doctor offices across the U.S. Testing is performed on Abbott's ID Now platform. The new test comes in the form of a small cartridge that fits in the palm of your hand, said John Frells, Abbott's vice president of research and development. The test runs on the company's ID Now platform, a 6.6-pound portable device the size of a small toaster. There are currently about 18,000 ID Now instruments in the U.S., the most widely available molecular point-of-care testing platform in the nation, Frells said. Unlike high-throughput batch testing platforms that can run hundreds of tests at a time but take several hours, the ID Now platform is a benchtop instrument used at physician offices and urgent care clinics. The platform is typically used to run tests for other respiratory illnesses, such as the flu, strep and RSV, and similarly uses samples from throat and nose swabs. 8 strains of the coornavirus are circling the globe. Here's what clues they're giving scientists. Last week, the FDA approved another coornavirus test from Abbott, the M2000 real-time SARS-CoV-2 EUA test, which is used for large batch testing at university and community hospitals. Other companies have also received emergency use authorization from the FDA, which allows for the use of unapproved medical devices during a public health emergency. California-based Cepheid said last week that it received authorization for a test the company says gives results within 45 minutes. Another California-based company, Mesa Biotech, said Tuesday that it received authorization for a palm-sized test that the company says gives results in 30 minutes. The test is intended for use at temporary screening facilities, physician office labs, urgent care and long-term nursing facilities. The coornavirus test that wasn't how federal health officials misled state scientists and derailed the best chance at containment. The U.S. has struggled to ramp up testing across the nation, and, in the early days of the outbreak, the Centers for Disease Control and Prevention initially developed and mailed flawed testing kits. Many doctors have reported rationing tests to prioritize the most vulnerable. Public health labs, as well as approved private labs, universities and hospitals, can conduct the tests. As of March 26, 92 public health laboratories in 50 states plus Washington, D.C., Guam and Puerto Rico had successfully verified COVID-19 diagnostic tests and were offering testing, according to the CDC. While there are no official nationwide testing totals, the COVID Tracking Project, an online effort started by 2 journalists to track the number of tests conducted in the U.S., said Friday that more than 620,000 tests had been completed nationwide, the most tests conducted by any country. But the U.S., with a population of about 329 million, is